Good morning.
Good morning.
Okay, please begin.
Good morning, everyone. Thank you for joining. It's good to see you all this morning. I and you probably got a notice from Liz Donovan that her term is ending on the town council, so she will no longer be participating with our group. And we do wish Liz the best and thank her for her contributions. Let's see, looking at the agenda, first item is the approval of the minutes. Any questions or corrections?
No.
All in favor of the minutes as they are?
Yeah.
Aye.
Aye. Thank you, Alyssa, again. Kevin is joining us. Kevin, you there? So
I am, Harrison.
I don't know what your schedule's like, Kevin. I have you under new business, but
Let's do it later in the new business.
Okay, sounds good. Okay, so reports. Health Department, Jen.
Hello, everyone. So
Hello.
I guess we'll start with the vaccination update from DPH as of September 30th. Ages 12 to 17, we're at 96.69%. Ages 18 to 24, we're at 100%. Ages 25 to 44, we're at 100%. Ages 45 to 64, we're at 87.95. Ages 65 and over, we're at 100%. Percent of population total with one dose, 78.94%. Number of fully vaccinated is 14,660 residents, or 72.46%. Number of doses the health department's administered to date is 14,308. We started the booster clinics last Thursday. I want to thank Kevin for helping find a location for that. We spent several weeks on that because we wanted to keep the seniors in town, where a lot of these seniors previously had to go to Stanford Hospital and such, because when Pfizer first came out, they had different storage handling requirements. So last Thursday, we did 140 residents. Today, we have registered 67, but I'm sure we'll get some walk-ins. I've begun discussing with Dr. Lutzy, planning large vaccination clinics for the schools, because the FDA is meeting on October 26th to review data from Pfizer for the ages 5 to 11-year-old. So I've asked Brian to give me total numbers of each school so we get an idea of how many kids we're looking at. And then we'll play it by ear when it's approved, because after the FDA approves it, then it's got to go to AICP, then the CDC weighs in. So it's usually like another week. So sometime, probably the first week in November, we will be doing that, which means the second dose will be right before Thanksgiving. So it's kind of good timing for the holiday season. DPH did say yesterday, they are expecting it to be different dosage and different vials. So it won't be the vaccine that we currently have, is what they're anticipating. So I'm not sure exactly what the dosage will be yet, or how that's going to roll out with supply, because they're going to have to manufacture a whole different, vial for that. Testing update. To date, we've done 502 PCR tests with Waveney. I want to thank Russ and Waveney again for helping us out. It's been great. It's been going very smooth. We were at the Paddle Hut. We just moved to Irwin, and it's going well up there. Out of the 502, we've had 9 positive for a positivity rate of 1.79.
Dan, what was the period of time for the 500 tests?
It's 1 month, August 24th through September 30th.
Thank you.
And twice a week. And then the number of rapid antigen tests that the health department's done at our office is 179 with 6 positive for 3.35% positivity rate. It's important to note that most of the rapid tests are symptomatic people that we're doing. That's the whole intent, is to So we're expecting a higher positivity rate on that.
Jen, you're saying even though all those people or most of them had symptoms, only a small percentage, 3%, ended up with COVID. The others had something else.
Right. There's a lot of seasonal allergies, but people get nervous when people are coughing or sneezing. So it's better to come get tested. It's quick, 15 minutes, you have the results. Okay. Moving along.
Jen, what are the hours for that testing?
For what, the rapid testing?
Yeah.
Rapid testing is anytime during our business hours, 7:30 to 3:30.
Okay.
So we also tell the school nurses too, if they have a sick kid in the nurse's office, they can send them over to us, which they've done. So it's been working out pretty well. Environmental wise, we're at already for this year, 112 building permits reviewed, which put that in perspective. We only did 265 all of last year, and all of last year was a record year. So yet again, we're getting crushed with permits. We've done 7 daycare inspections, 2 full-blown lead abatements in the last month, including dust white sampling and clearance closures. We've had 20 housing complaints in September alone, mostly tenant landlord disputes of mold, water leaks with all the rain, and then a few restaurant garbage complaints, but mostly housing complaints, which is expected. And that's about it.
Jen, our positivity rates are still from young children and traveling?
Not really young children. It's this week, the 3 cases are 25 to 60 years old. But yes, traveling in large events.
I have a question. A physician notified me that, or had an opinion that the Moderna vaccine is stronger than Pfizer, and therefore that's why there's sort of lagging time on the 3rd shot, that there's really no reason to worry that the 3rd shot will be there in its good time. In the meantime, we're totally protected. Is that your sense of things?
So what DPH has said is with the Moderna, if it gets approved for a booster, it's a big if, it would only be a half a dose because of that reasoning. The Moderna is 100 micrograms where Pfizer is only 30. And, wow. And it's also diluted. Moderna is not diluted with the saline. So there is a difference, even though they're both mRNA vaccines, there's a different dosage, which is why too, people had more side effects with Moderna. Right. And Pfizer has said they dosed it the way they did because they didn't want the more side effects. So there is a big if Moderna will even need a booster and when.
Oh, okay. Well, that's good news. Okay.
Right. A lot of that is to be determined. And, the Pfizer did Israel, and the numbers came out of there where the boosters, it seemed to be not as effective. And the question was, and still lingers, whether was it the vaccine or was it the Delta variant? So that was the delay too, but the government has gone ahead with the booster, playing it on the safe side. Just giving an update on the New Vance hospital system, of which Norwalk is one. They about 10 days ago, they had 100 patients in their 7 hospitals, although only 6 actually admit COVID patients. They're using the Regeneron, the monoclonal antibody, primarily in the emergency room. If you get that within 4 days, if you're symptomatic, test positive, you have an 80%, it's 80% effective in decreasing hospitalization and death. Other drug companies like Eli Lilly, which did have one early on that was being used, a monoclonal antibody, but with the Delta, it was not as effective. So they moved to Regeneron on a 100% basis. And GlaxoSmithKline and other pharmaceutical companies are in the process of developing these monoclonal antibodies. And they are very helpful, as I quoted that 80% number. Merck came out with their new antiviral, which there are only 750 people in this study, so not a large one, but it's considered to be about 50% effective in preventing hospitalization and death. Little update on Yale Children's Hospital. so far this year, they've had 188 COVID admissions, 5 with their MISC, their multi-inflammatory system disease, and 15 with myocarditis. And they all were discharged to date. So that's very positive news. Thank you, Jen, for the update and the work.
Harrison,
Yes.
Any observations for those in the hospital with COVID as to their vaccination status?
Yeah, they are almost, if not everyone, they are not immunized.
Yeah.
You know, I could say that 3 to 4 weeks ago, everyone being admitted to Stanford Hospital in Norwalk had not been vaccinated.
Wow. So it's pretty black and white that.
Oh, the vaccine is, yes, it is the way to go.
And Tom, on Thursdays tonight, the governor does a very comprehensive update, and it's all online on the ct.gov, and it gives you a whole breakdown of the vaccinated and the unvaccinated cases in the whole state and hospitalization wise. And it is very clear and very black and white.
Okay. Thank you.
Next item on the agenda, Human Services. Bethany.
Hi, everyone. All right, and we're going to start out with some stats, and then I'll get into some more meat of the department. So I'm doing numbers for the first quarter of our fiscal year 2022. We've maintained average clients haven't really increased. Some people have moved, come home, come back. So we're talking, I don't know, between Jackie and Marcy, we have, I don't know, almost 350 clients. And that would be about over 90 households. Domestic violence cases have doubled. A year ago, we had 5 for the quarter. This year, we have 11 for this quarter. And so this is mainly Jackie's department with youth and family, and she's been working really hard on that. The referrals, we've had over, 40 some referrals in terms of we're really communicating well with police and the schools and other organizations in town. So that's been wonderful partnering. The food pantry, we've really settled back into our pre-COVID numbers. We have about, for the quarter, we served about 375 individuals, and that would equal about 170 households overall coming over the 3 months. Some repeat, every 2 weeks, others come once a month, and LAPM activities, now since LAPM was opened, Marcy's going to go into that. And the telehealth data, we have seen a decline. We've gone, a year ago, we had 35 members, active participants. We're down to 25. A lot of this has to do with, we changed the Fitbit. The Fitbit Zip has retired, and so now we do the Inspire. And as a result, we don't need batteries anymore. And the people really used to come into Human Services to get their battery, and now it's a charging basis. So the people are still in the program, but they tend to be more independent with it, as the little Fitbit that we use is more independent and doesn't require a battery, and thus coming into Human Services. Seasonal programs that will, Marcy and I will let you know about energy assistance, renter's rebate, the food pantry, farmers market vouchers. That was a success. We had about almost $2,000 generated with 44 families, and it was a success. So we've done a second distribution of the vouchers for the last half of the farmers market when it closes in November. And the back to school program was a success. We did 61 children, that's 34 households, and they all received a $50 gift card to Walmart, as well as Salvation Army gave a $25 card as well. And we issued them a lot of food gift cards in the town that have been donated by various people and the New Canaan Moms. Let me see, our financial assistance for this quarter, we issued about $11,000 coming from the Salvation Army, the New Canaan Community Foundation Touch a Life Fund, as well as our Human Services Special Projects Fund. And most of that went to rent. About $5,000 went to rent, and then followed by electric and utilities. So the seasonal flu clinics start tomorrow morning with the Senior Men's Club. And we have a couple clinics at Lapham, Schoolhouse, the employee flu clinic in conjunction with the health fair, which is in the end of this month. And what else? We'll have by appointment as well at Human Services and walk-ins. Blood pressure clinics, there's been a large uptick at Schoolhouse and Lapham. People are very engaged in their health right now and getting back to walking and getting out. The Get About their rides are increasing as well as the world opens up for the seniors. They were only allowed to take one rider at a time. And so they were having events at Lapham and they didn't have enough vans. So there was a change that they're now able to take more than one person to an event, because they're going to an event anyway to be around people. But the medical care and things like that, it's just one person.
And they have to all be vaccinated, Bethany?
Vaccinated, and the rides are the masks, and the drivers, everything is still COVID compliant. Whatever Jen, issue, they're following those rules. Let me see, choices. The choices, Medicare Part D enrollment begins October 15th. Marcy and I are continuing our trainings. It goes until December 7th. Lapham does a huge focus on that. But Marcy and I we'll take the troubleshooting cases and anybody else that walks in. But
I have a question, Bethany.
Yeah.
Medicare Advantage it seems to be in major transition. They just sent out a book which confused me more than helped me. Is there somebody within the system? I know you guys do Plan D, but is there somebody in the system that can explain Medicare advantage or disadvantage?
Yeah, so Marcy and I, give us a call. Yeah, I'm happy to go through that with you and telling you.
Okay, thank you.
Absolutely.
That's a good point though, Jim. And, just for the senior citizen public, I know they were giving talks and educational sessions at Lapham through the years, but, with little changes and people don't know the subtleties of these things, whether it's the supplement or the whatever.
Yeah, and there's a lot of, Medicare 101 is just overwhelming as it is in terms of Advantage and Gap, Medicare gaps and supplements and knowing all those buzzwords. So Marcy and I are here. We tend, if somebody wants not just to get their drug comparisons done and enrolled for the year, right, we're here to absolutely go over things and explain and answer questions and stay as long as you want.
And Bethany, our social workers are also available to you if you'd like, right, in helping out. We find, to Jim's question, we find that a majority of our residents and applicants are actually switching back to traditional Medicare for some of the coverages that they thought they had and didn't get at 100%. So we're helping with that transition also.
Yeah, and
there's a quick question. Do we know what our unemployment rate is in New Canaan right now, or our homeless rate? We talked about transitions. We talked about, people who had been renting in New Canaan and the owner wanted to sell the house because the market has been so strong lately. Has that been a problem, those two factors at all?
No, I think one case was drawn up from that issue. That focus. People definitely are coming to New Canaan wanting to find housing, and they can't. We do have resources where they can go elsewhere, but New Canaan, with the overall safety of the community and accessibility. I mean, it's in high demand, as is the other towns around here, the quiet towns. But
I don't have the unemployment number.
It should.
But we're one of the lowest in the state, is all I remember, and it's getting pretty low. There's still more jobs going begging than people.
Yeah,
it's interesting, but hopefully that's going to be fixed.
Yeah.
Russ, are those people who are switching from Medicare Advantage to just standard Medicare, are they getting the Medicare supplement or just nothing else?
No, they're not. I mean, they're just sticking with the traditional Medicare plans, and we're working with them through it. And again, you know, being a nonprofit, we always have a tremendous amount of charity care to fill in that safety net for them. But yeah, I think there was people had gotten into Medicare Advantage. A lot of the marketing that was done, I mean, they have spent a tremendous amount of money, as Jim can attest to, and Tom and others, the flyers that go out to our age group, and it gets confusing. And I think once you sit down, like Bethany had said, and look at their medication, look at the services and their choices being taken away from them, you know, we find the vast majority, if not all, are switching back to traditional Medicare.
Russ, does that have to do with the doctor that they want or other provider not being in the Medicare Advantage contract?
Well, that's the key. That's the major differentiation between Medicare, original Medicare, and supplement Medicare Advantage plans. The Medicare, any doctor that is a provider.
Yeah.
To Tom's point, though, the feedback we're getting from physicians is they're taking more and more of a haircut staying in a Medicare Advantage. And as most of you know, physicians that are in town and are in this region, some don't even take Medicare Advantage at all or participate. So it becomes a private pay kind of business for the relationship between a patient and physician. So I think Mark, you know, I think you're correct, Bethany. It really comes down to their physician choice and just the amount of services that they can actually get.
And a lot of doctors, they don't take Medicaid anymore, and they don't have to. So as a result of that, you know, it's pushing people seeing doctors in the surrounding area.
As a senior civilian, what I'll tell you in my work on the Medicare Advantage over the last 2 or 3 weeks, it looks like nothing but a thinly veiled way to turn the Medicare into an HMO. There are some options, but they make it so damn difficult that the easy slide is into an HMO kind of model. And it's not what it's touted to be by the insurers, and it's changed totally. Typical bureaucratic thing. It was meant to make it easier. All it did was confuse things. Yeah. Anyway, thank you. I'll be in touch.
Okay. All right. And then let me see, continuing on, had a very fruitful Zoom meeting with New Canaan senior-based organizations, and Waveney set that up. Thanks, Russ. And Leo Carl was the facilitator, and we did an awareness and collaboration as a whole, brainstorming and talking, and we're going to meet again too. It was very, very good. The other thing is we're having a coat drive starting this week with police and fire. Drop-offs for coats will be at the police department, fire department, and then we will have them available at the food pantry starting after Thanksgiving, between Thanksgiving and Christmas. So that's about it in a nutshell. We're busy, but once again, our number of phone calls have decreased, but the phone calls we're getting are very complicated. The cases, it's not just a quick phone call and launch them into another resource. It really is a team aspect with Adult Protective Services, police, DCF, Human Services, the whole thing, it's much more complicated each case. So it's taking a lot more, and the resolution is taking a lot longer. So that's it for us.
Okay. Thank you,
Bethany, for all you guys do. The geriatric psych needs have gone up dramatically. I don't know if you're seeing that, but we are certainly.
Yeah, definitely. It was interesting at this Zoom meeting that Waveney put together. Talking to LAPM, like Aggie Espinwall, who's the director at LAPM, she said now that LAPM has opened up, seeing the difference of not seeing these people for 18 months, the seniors, the mental decline is apparent because of the isolation. And some people, they want to continue the Zoom meetings. So there is a hybrid, but she wants to get them in and socializing again. But across the board, all the organizations that were there said they saw the same thing. So it is an issue, and that's a huge gap, is getting people to come back into the community again. And there's a difference between isolation and loneliness, but because of COVID, they're enmeshed. And it's how do you get people out of isolation and used to socializing again?
I mean, still the depression's increased, anxiety coming into the public has increased, substance abuse for the seniors.
Whole thing, yeah.
I mean, all the above. So we just need to be sensitive to that. And I know we all are, but it's great to live in a town where we're all working together, collaborating. Yeah. So thanks.
Definitely work in progress.
I'll call it positive news, and may have some bearing on this. Staying put, we operated in Zoom mode and delivery mode through the pandemic, and that's completely reversed now. We're having in-person meetings and get-togethers, and we've added 62 new members this year, which is unheard of. Typically at 20 or 30. Last month, we had 13 new members, including a lot of men. And we have a monthly men's coffee with about 20 guys at now. So the character of staying put has begun to change much more in the direction that I always hoped it would be. So some of you guys on this call can join, but
I have you, Tom.
Yeah.
Too young, Tom.
Yeah, but I wonder if some of our LAPM people and some of our human services clients might be interested in membership. And of course, we have very flexible costs. So if people have trouble with the dues, which are $400, we're very flexible in reducing those or even eliminating them altogether. So anyway,
great, thank you.
An opportunity.
Excellent.
Thank you, Tom.
You bet.
Next, the Adult and Senior Services, Marcy.
Good morning, everyone. Let's see, our programs at LAPM have started up. On Wednesdays, I am there for a couple hours every Wednesday weekly. It's sort of a casual drop by, and I'm just trying to get the seniors to get to know me and feel comfortable with me. I am available to answer any questions on that day. Thursdays are a little bit more formal. We started our first Coffee with a Cop. Officer Vartuli was amazing. She got, I think it was 6 other police officers to swing by, and they answered questions, they introduced themselves. They were fantastic. And we are going to be doing another one October 14th at 1 o'clock. And we are hoping to do that monthly. It was really fun. I think everyone enjoyed it, the police and the residents. We are also doing a group. I'm doing a group with another senior social worker, Robin Rockefeller. Our group is called Life Reimagined, and that started as well. And there were 10 people in our first group. We now have 13 signed up for our October 21st group, which is fantastic. It's almost too big. We may have to split it into 2 groups. So that's very exciting. And I'm continuing, as Bethany said, to work with police and adult protective services on a few cases involving some some serious mental health issues, as well as some aging residents that are in need of assistance in order to stay safely in their home. So I am working with those organizations. Renters rebate finished up October 1st with a total of 29 applications and $21,000 in rental assistance. So that finished October 1st. Like I said, energy assistance has begun, and to date, I have done about 21 applications, but we have until May. So I anticipate a few more. And that's about it for now.
I want to pick up on Russ's comment on the geriatric psychology and psychiatry needs. We have this Let's Talk About It program that's been in business now for the last 4 or 5 months, maybe 6. I'm wondering if indeed you're getting any playback from your customers, Marcy, that are participating in that. It's frankly heavily designed for youth and families, but seniors are an important part of it also, or should be.
I have not heard of any seniors taking part in that, but with the amount of people who showed up to just our first group, it's obvious that they are all sort of looking for some sort of support, be it formal or.
We need to talk to Bob Dorn and that group and get some publicity for seniors and get some content in the program. Perhaps it's it's typical thing like the telehealth. If you don't keep merchandising it, it doesn't get any notice. So, and that's it in terms of the community psychiatry effort, as it were. And obviously the problem is there across all ages.
Right.
Okay, thank you.
So, Marcy, anything else?
Nope, that's all. Thank you.
Great, thank you. Jackie?
All right, I'm Jackie today. Jackie is at a SACS event with Dr. Pote, talking to the community about the title is The Ups, Downs, and All Arounds of Middle School Friendship. And so they're going into how children interact at different ages, fostering independence, and how to talk to your child, things like that. So like Marcy, Jackie has been out in the community and she's doing that today. But I do have her report that I want to give to you, and she will, once again, as I said before, her numbers are up. Let me see, the DV cases that she's had is 6 this month. I think we've had, what, 11 for the quarter. 6 this month. The fuel applications for energy assistance, those she's had applications for those. She is doing a meet and greet at Millport Apartments for the East School families. And so that's wonderful to be out there going to the property itself. And moms and kids know that she's going to be there at a certain time. She put the pinwheels, I don't know if anyone's noticed, with NCL 7th graders on the displays on the library lawn. So please see that. And she has done a training with successful bystander intervention for adults. And this is partnering with the Domestic Violence Crisis Center, New Canaan Cares, Human Services, First Presbyterian Church. So a great collaboration. And she's working with social workers at the Board of Ed with 2 cases. EMS has called her about some cases, and she's working with the LGBTQ network and getting referrals there. There is the guidance officers at school are reaching out to her, and she is collaborating with the organizations in town to have some bullying and domestic violence awareness at the high school and at SACS this month. So that's what Jackie's doing. Once again, I want to reiterate, Jackie and Marcy are just getting out there in the community and making human services a wonderful resource for people, and we're just educating and getting our name out there. And I think they're doing it in an unbelievable way. So kudos to them.
Yeah, I agree. And thank you for all the work that you're doing.
Thank you. Oh, really just quickly, Bethany, I was at the the domestic violence bystander intervention thing that Jackie did.
Yeah.
And I do think it also applies to bullying. I know that they would like to get it into SACs. I think it would be great. It really gave some like very tangible steps, how to intervene, different tactics. They did scenarios with us that involve, like what children could do too. I think it would be great if they could get that into the middle school and high school.
Excellent. All right. I'll relay that feedback to Jackie.
Also, I listened to the pod. Yes, Kevin?
Can I make a comment, Harrison?
Yes.
Following up on what Marcy said about the police coffee with the cop at Lapham. I'm wondering if Jeff at the high school ever has the other cops come in like Marcy did. I understand Darien does a really good job of introducing their police officers to the high school kids, partly through the depot, and I think that's something that I wonder if we're doing that, because if the high school kids who are drivers can meet the various cops, it's a really, so when they finally meet them on the street, they will and inevitably do, they feel more comfortable. I wonder if we're doing that.
I'm not aware of it, but I think it's an excellent idea.
Yeah.
I mean, because our young police officers, all of our police officers are terrific, but it's helpful for the high school kids to get to know them. So
yeah, I wonder if Jeff Deek does that informally.
Marcy, you saw how you get the cops together, and it really can be quite impressive. So
it is, and it, like I said, I think last month, it's just really nice when residents of any age, like the kids as well, can put faces to names and right. Feel a little bit more comfortable there, as not as intimidating. They're also people. I don't know much about the Darien program. I do know that the depot is available for the police to do things with the kids. A little bit of the police force in Darien will also do activities with some of the elementary and middle school kids, like a school fair. Some of the police will be at the school fair and actually do activities with the kids, and basketball pickup games at the depot and stuff like that. So, with having that depot, I think there's a little bit more of a opportunity, but, maybe Jackie could reach out and do something at like the schools during lunch or something.
Great idea.
How did you get 6 officers at the same time at Lapham?
It was very impressive. The room was so crowded that some of them had to wait in the hall. So it was a great afternoon. Yeah.
No cars were stolen that day, Kevin.
That's right.
That's right. Just to get back to Jackie's sector, she was involved with getting this woman, Emily Torchiano, to talk about, and she started the nonprofit Lost Got Found, quote unquote. I don't know if any of you have heard her podcast, whether she was on Let's Talk About It. Are you aware of that, Jim?
I am not.
Okay. It's worthwhile putting it on there, even for the senior citizens to listen to it, and the effect that social media had on this one person and a couple of other unfortunate circumstances in her life, and how she has rebounded and done this. She is a very articulate, well-meaning individual. And Bethany, did you hear the podcast or no?
No, I haven't heard it yet.
Okay. I would recommend it for everyone. And even getting her to talk to the high school and middle school students would be very worthwhile, because we don't know what's going on. We know the effect of COVID, the effect of social media. I mean, it was blasted on 60 Minutes the other night. It's all over the paper with the news, correct or not, with the whistleblower. So it's a major negative factor that's going on in our society, and this woman addresses it very well. Next item, old business, kids in crisis that keeps popping up. I think we have some good news. We were told that's the case anyway. There's a teen talk counselor now at the high school, or is going to be starting next week, I think. His name is Greg Sloan. I'm not sure everything is totally finished in the application process, but that's where we are. Kids in crisis, we're happy about it. I did ask for CVs, did not get them as of yet until everything is finalized from Kids in Crisis. And also they are interviewing, quote, wonderful candidate, unquote, a female for SAC. So we'll have more information at our next meeting. I guess my only little question was that, we've had males at the Teen Talk Council at the high school, and it's worked out well in the past. The last few have been women. Okay, well, anything else under old business? Okay, we'll move to new business. Our first selectman, Kevin Moynihan, wants to talk to us about the ARPA funds post-COVID, how we can utilize them. And the floor is yours, Kevin.
Thank you, Harrison. So as you know, we're trying to figure out how to spend $6 million of federal dollars that are coming to us under the ARPA Recovery Act. And there's been a town council public hearing the other night. We had a forum back in July with sponsored by the Community Foundation and Chamber of Commerce and the TDAC committee. And so we're looking for ideas. And obviously one of the primary things is COVID impacts. And I don't know if the Human Services folks have given enough attention to how we might use federal dollars or these grant dollars for Human Services needs. One idea that really started like 2 years ago, based upon a conversation Paul Reinhardt and I had, was that Silver Hill Hospital is a terrific resource for us. And then in the past 2 years, I've seen several situations where people are in crisis and they spend a lot of time figuring out where to get services. And Silver Hill Hospital, Dr. Andrew Gerber, the new CEO of Silver Hill Hospital, who's also our behavioral health, medical director, which replaced Dr. Mia Handler 4 or 5 months ago when Mia moved on to other things. Dr. Gerber is behind the idea of having Silver Hill Hospital available to evaluate and then help determine what support services are needed. But the idea of this this fund that Paul Reinhardt and I talked about was, even though Silver Hill Hospital is willing to give a certain amount of charity care, as Russ Barksdale does with Waveney Care Center, they can't give extended services for free. And oftentimes when people are in crisis, they may or may not have private insurance. And there's a certain initial period where people need some services. So the idea would be to have Silver Hill Hospital be able to draw on a fund when they have to provide services for a period of time until the proper service provider can be determined. So this was an idea. We put $250,000 into the matrix, we're calling it, of possible uses of these grant dollars. The idea would be to have this become a seed fund for something that could grow with the Community Foundation support, so that fund might grow over time. So Silver Hill Hospital always has a fund to draw upon for this need. So that was the idea behind that, and we need to pursue it further with Silver Hill Hospital. I don't want Russ to get the idea that we're going to do it with Waveney as well, but perhaps we should.
No, I've given up on thinking that our charity care will get covered by the town. I've given up on that idea.
We talked about that, but no. So seriously, I think so. I'd like you folks to think about other COVID impacts and what we can possibly do as programs that are, especially ones that are impactful initially, or seed a program that can be developed further. We've heard a number of ideas, things that are ongoing, and we want to continue to support them. So I just want to throw that out there.
No, I think it's a great idea. It's a win-win. It's a win for Silver Hill, obviously, but it's a win for the community, because, as you're right, people in these dire circumstances often do not have insurance or have inadequate insurance. And even if you have great insurance, it's terrible coverage for all psychiatric conditions, including hospitalization, and the treatments, outpatient, et cetera, are very expensive. And if you're in need of intensive therapy, you can put your house on the market, even though the prices are pretty good these days. Get that to pay off. It's kind of an extreme scenario. So if we could perpetuate this, build on it, make sure it's being utilized effectively, that's always the question mark, and provide financial assistance to people in need and in need of behavioral health. And if Silver Hill is the place, it's fine. So, you know,
I would just add to that. We've been working with Andrew and I closely since I arrived. Great guy, great idea, great supporter. But with any of these concepts, it is having somebody available 24/7 because it is truly a crisis intervention. And we have seen, without being very specific, what happens in the geriatric population, which either they discontinue their medication or they get into crisis, and then you have a domestic issue that could be create even a death in the family. And we've seen that here, even in our small community of New Canaan. So I would fully support all of those initiatives, but know that it needs to be manned and it needs to be 24/7 kind of coverage. And Silver Hill, I think, is a great supporter of the program. And Andrew and I have had many conversations on the need for geriatric psych support, but it is a crisis intervention. So I just want to make sure that whatever we design has that 24/7, 365 kind of coverage, because that's really what it takes.
Right.
Yeah,
Go ahead.
Yeah, I'm just thinking in terms of the process for doing it, in terms of qualifying. Yeah, I just want to make sure, I mean, Human Services can have a part in it. How are they going to have a part in terms of liability for the town, and how to make that process smooth for the potential client. And so we keep it a win-win situation. And I think it's a great idea. We've had people that we have called Silver Hill for asking if there was any scholarships that we could get in. I've gotten one person in a few years ago that it was available, scholarshipping, but it's tight and they don't have the scholarshipping the way they used to. So to have something like this for a town resident, and if they qualify, I think the key thing is qualifications. Even if you have a lot of money, it's still so expensive, it might not be enough. So what are we going to use as our qualifier in terms of who can?
Question for those crises, is the person affected treated at the inpatient psychiatric facility at Silver Hill or in the residential programs? Which of the, because they're two very different pieces of Silver Hill,
it would depend what the problem is.
Yeah, it all depends on what the problem is. Also, the advantage of New Canaan residents, I mean, you can be treated on an outpatient basis as long as you're not a threat to anybody. And so having the convenience of having the doctors right in town and the residents in town is a huge leg up to have them be the immediate providers. If, you know, and again, we're talking about the initial days after something. Someone ends up at the hospital because of an incident, suicide attempt or something. They need, and the family especially needs, immediate help of someone, and it, you know, for them to figure out insurance and figure out who the providers are. I mean, you know, in the past, someone gives them a sheet of these are 12 providers you can call. I mean, that's not really great support.
Well, you know, we have kind of a precedent in that when you call the ambulance corps here, you don't get a bill. And that applies to anybody they serve. So and of course they're supported by the town partially and then by donations, and they operate, I guess, quasi-publicly. But that's, we already have an example where there's a free healthcare service for town residents and others served by ambulance corps. And maybe
that's qualifications just based upon the need. I mean, whoever needs it gets it. And because crisis is crisis.
Yeah, and ambulance corps, that's a crisis often, and so I think we already got our foot in the water here. So
yeah, I just want to define like these things like resident. Is it you know, a parent that has a child that goes to school? That's what makes a resident. You know, it's the qualifying process. I just want to have down. So
I think it's a great idea, Kevin, and I I think you've got a great group here. We can all work together on this, and Andrew's a great partner. For me, it's timeliness, right? So calling 911, I agree. I mean, at an acute care standpoint and EMS getting involved and taking you to the hospital, there's too many times that person who was abused or in that incident has to return back to that because they're not admitted at that time. So it is, I get back to a crisis is a crisis, can happen at any point in time, and 24/7 coverage of having an intervention team, if you will, is probably a great idea if we can get that put together. But that is a 24/7 coverage, and we need to be able to move in it before it becomes a 911 call and before it becomes true domestic abuse or some other ramification of that. So that would be my vote, and I'm willing to help and support any effort towards that.
Yeah, Russ, I mean, the kinds of incidents I'm thinking about are substance abuse and suicide and things that maybe 6 times a year.
Right.
So it has to be 24/7, but it's also 6 times a year. So
often for these acute scenarios, half the time anyway, they have to go to the hospital to have their physical status evaluated. And so that's the EMS, police, et cetera. To have a psychiatrist on call 24/7, which is probably all we could get from Silver Hill, that would be good. And they do have it anyway, but often you'll be sick, let us know in the morning, et cetera. And often, Norwalk, whatever the hospital is, Stanford, et cetera, they may not have psychiatric beds. They may not have exactly what's needed at that point in time. So it's a combination of things. I don't think you can fully staff Silver Hill on a 24/7, 365 basis to provide these kind of evaluations.
Well, Harrison, I mean, I agree with you. I mean, but it doesn't have to be a physician. I mean, there are other, nurse practitioners and other social workers that can help cover that. But we all know, I mean, 80% of the patients that go into see a primary care physician, for less than routine, typically have some behavioral health issue associated with that. So we know it's an underlying issue. I think it's way more than 6 times a year because if you ask EMS and you ask the police station, and my oldest son being a police officer, he finds that 90% of the calls that he has are somehow related to behavioral health issues, substance abuse, or some underlying issue, someone not taking their meds or staying on their meds. So I think it's a lot more than we may realize or tracking. But again, whatever we can do to support it, we're happy to do it.
Hey, Kevin, does this funding have to go through HHS? Because, I think it's a good idea.
My thought would be is it becomes a trust fund that is administered by the Silver Hill Hospital along with someone from the town, probably Bethany. It obviously has to be very, very discreet and confidential. So
I have a question, Kevin. How long do we have to put together a plan to protect that $250,000 budget?
Well, again, my concept, this is just the beginning. I'm Paul Reinhardt, and I said, how do we get this started? How do we raise money to begin to get this fund started? And then, there's people in town that would support this kind of fund.
Oh, absolutely.
So that I think, maybe ultimately it grows to $1 million.
I started this conversation with Dr. Santa Pietro 2.5 years ago when he was still here. I continued it with Mia Handler 9 months ago. And the problem was always that Silver Hill is a professional psychiatric place for treatment. And so they never had a budget. So the fact that we could put some gas in the tank on this thing is a terrific idea. There's no doubt there's a need for it. So I'm happy to do it. I just want to know whether there are 14 other projects in line for this, and we're going to have to compete rapidly.
Oh yeah, well, no, that's why I'm going to follow up with Dr. Gerber. We got to put some more meat on the bones. I'll talk to Paul Reinhardt. I mean, I was looking at it. Obviously, the seniors are. I wasn't looking at it so much from the senior point of view. I was looking at it from the the population that
Yeah, well,
it really gets into crisis, and the family is just doesn't know where to turn. So
absolutely.
We had, just to let you know, there was a woman in her 80s that Marcy worked with the family and the woman, and she voluntarily went to Silver Hill. Her insurance, her Medicare covered it. That part was great. The first 7 to 8 days when you're there, definitely covered. But then after that, that's another thing. The out-of-pocket insurance will not cover that outpatient treatment or the inpatient treatment. And so this family is financially able to give the mother this extended time there. So my interest also would be, after the crisis, the detox, getting the meds on a potential good path. The cost after the insurance doesn't cover it anymore. That's huge. And I didn't know if that could be woven in.
And that goes back to, where you're talking about Medicare versus Medicare Advantage plans. I mean, let's just forget about behavioral health and mental health rehabilitation. On the physical rehabilitation side, Medicare Advantage is about 1/3 of the length of stay and 1/3 of the coverage. You come in, you think you can, rehab for an entire week, and your Advantage plan says, no, you got to be out in 3 days. And a traditional Medicare participant has a little bit more flexibility and let the physician decide how long that you need in order to rehab. So a lot of this is education, but a lot of it is crisis intervention. It's not all just a senior population. I'm just saying that the geriatric population and the psych, issues is growing exponentially. And I think if we can get a program set up for that, it can help all age groups.
When you look at teenagers also, not only geriatric, but the eating disorders, the substance abuse, it's that $250K will go very quickly.
Oh, yeah.
To Bethany's point, there's just minimal coverage.
Well, yeah, kids in crisis is not going to be able, that's, and what's the other group over in Darien that's more an adult crisis management group?
Hope.
The Center for Hope, is that?
Center for Hope, yeah. So from the standpoint, there are, community activities available, but none of them are as, everybody's issues that you're pointing out of follow through and availability, et cetera. We need to get that organized. So I'd be happy to be on a committee for the thing with Russ and Tom and whomever. So let me know.
Yeah, this warrants further discussion of this particular topic.
Yeah. And if we have a month or two to get this together, Kevin, that would be terrific.
I was just going to chime in. It's Alyssa McKenzie, if we're still supposed to state our names. I think it's a great idea. I wonder how many people will come forward who have never thought that they could have access to psychiatric care. I know that even in New Canaan, there are a lot of people who don't even try. So I think we would also, when we're planning, try to gauge how many people might come forward that never knew that they could, have this kind of care in their lives.
Yeah, Alyssa, that's a good point. And that's why the qualifying too. And we have to make sure that we're clear and that our process is fair. And definitely it's based on, I don't know how we're going to base it, but it has to be a fair, continuous formula so that there's no gray area. Why did she get in and why didn't he get in and things like that? So I think we have to be able to substantiate.
I think you're misconstruing the intent of this. It's not designed to provide primary care. It's designed to deal with crisis situations.
Yes.
Right, but that's when primary care.
Yeah. I know so many people, who don't even go to the emergency room because they know that there's nothing they can do afterwards. It starts with the crisis.
And yeah.
Okay, well, let's figure it out with a pilot recommendation. And we got more money now, at least on paper, than we had before to make it happen. So designing a pilot sounds like an idea to me. Yeah. It's well overdue, and it's something that the commission should undertake.
One other issue, Lance, thank you for your involvement with the overdose awareness vigil. Were you happy with the attendance? I know it was bumped from one night to the next. Are you there?
Very happy with the attendance. And I'd also, just on this subject matter, I'd just like to recognize again, Paul Reinhardt and what he's doing with his parent support group. In other words, prevention. Joyce Sixsmith with the kids that got, bringing kids into the program with the RAM Council. And the thing that I'm more worried about than anything is now that pot is okay in Connecticut, it's the worst drug you can use. I'll be honest, that's a little prejudice there. But I think we need a lot of more information made available to parents and kids in regard to the use of pot. That's where I'm coming from.
Yeah, thank you, I agree. Okay, I think that's it for today. Our next meeting is going to be November 4th, same time, same Zoom. May I have a motion to adjourn, and thank you all for being involved.
So motion to adjourn.
All those in favor?
Yeah.
All right, okay, stay healthy. Good seeing you all.
All right. Thank you everyone for all you do every day. Thank you.
Thank you. I'm going to stop the recording now.